This network is disturbing a lot.
Yeah. So you go to the WhatsApp that I share now, you get the PowerPoint. Just yes, network is quite this moment. Yeah, so I've just shared the presentation. I think let me share on both groups, science and arts. All right, I think we are good to go. So you should be able to access that presentation, though I will not be able to share it here. So what is an NGO? And how did NGOs come into existence? NGOs came into existence after unfortunate events that happened following World War II. And then by that time, the UN called upon private organizations to come and join hands to solve problems that were caused because of the war. And that is when now people started organizing themselves and trying to put some work to make sure that people's suffering is alleviated. And then, of course, that is when now the term non-governmental organizations came into existence. But in general, non-governmental organizations or non-profits mean that these are entities that operate independent of the government, and they contribute to creating social impact and alleviating among this. It is around this company. GoFundMe is a platform where you can write your proposal about a particular project that helps in addressing particular societal problems or individuals, and then people contribute to you, contribute funds to you. So that was kind of an initiative that it was intended to make sure that people contribute resources to make sure that others, that the others who are in need actually get help. And then, of course, NGOs, for us in this society, we are used to the word NGOs a lot. But of course, there are other terminologies that can be used to describe the NGO sector. So we have what you call philanthropy. Okay, philanthropy. We have what you call independent sector, third sector, voluntary sector. You can also call it tax exempt sector. We have what you call charitable sector. Sometimes you can have the word civil society sector, and then also social enterprise. So I'm going to go through each of these. These are words that can be used to mean NGO, and you should be very familiar with them. So the NGO world, if I can use that, can be described using all these terminologies that I've just explained. So the NGO can be called non-profit. Okay, instead of having you calling the organization as an NGO, you can just call it a non-profit organization. And with the non-profit organizations, the directors of the organization do not share and the profit that they are. For example, we have what you call a social enterprise. A social enterprise is an organization that is run on the principles of business, but their motive is not basically to make money, but it is to create an impact in the society. So an example of such, I can use Restore Institute. Restore Institute is a kind of a social enterprise. Why can you call Restore Institute a social enterprise? It's a social enterprise because we are a non-profit organization that is Restore Initiative, and it owns Restore Institute, which is the institution. And we charge students to pay some money. But our aim is not to make profit. Because if our aim was to make profit, there is no way we could be charging the same amount of money like government institutions. Government institutions around, I think they charge about $200 or $250, an equivalent in South Sudan pounds. So our tuition is closer to what the government charges. And then if you compare with the private institutions, the private institutions actually around, they charge about $400 per semester for degree courses. But for us, we are around 250. So you can see that for us, we charge relatively lower compared to the private, and we are also closer to what the government actually charges. And therefore, a social enterprise is not aiming at making a profit, but it aims at solving a particular social problem and making sure that there is an impact that is created. I guess that is very clear to everyone. If you ask what is a social enterprise, you should be able to explain what a social enterprise is. The word independent exemplifies that the organization carries out its own operations without the interference of the government. But that does not mean that the non-profit is above the law. And the law is administered by the government. So even if we say that the NGOs are non-profit, I mean they are independent, it doesn't necessarily mean that they operate their own laws. They still have to obey the laws of the word third sector is you have sector, and then you have the third sector, which is the non-profit sector. So that is where the term comes from. Then you can also call the voluntaries is people join the organization voluntarily, okay, voluntarily without the need for coercion to join. Okay. And this is associated with the fact that often when NGOs are being formed, they also rely a lot on volunteers. So these volunteers, because even you, if you start an organization, you're not going to be paid. No one is going to pay you. It's just like what I actually do with Restore. I've been doing work for Restore since 2019, when this idea came up. So I've been working for Restore since 2019 up to now, but I'm not being paid anything, or I'm not paying anything to myself. So it is voluntary work, and that actually is what is linked to what we say is the non-profit sector is a voluntary sector. There is that connection there. And then there is a concept of being called the tax exempt sector. Tax exempt sector. Tax exemption means that for you have been exempted from paying taxes. So to some extent, the non-profits are exempted from paying taxes. Okay, but that does not necessarily mean that a non-profit organization or NGOs don't pay taxes. NGOs pay taxes. So how do they pay taxes? If an organization has 10 employees and it is paying them a salary of $800 per month each one. So when the month ends, that NGO has to pay that money, but part of that money has to be deducted for taxes, for income taxes. So the NGO actually pays taxes through this money that they pay to the employees. But also, there's what they call value-added tax. For example, if the government may have tax on oil, okay, on fuel, for example. So the fuel that comes from that comes into the country is being taxed. And then the person who also will make sure that increase in the cost of the fuel, such that the people who are the final buyers of this fuel actually compensate for the tax that he has paid to the NRA. So that means that when an NGO goes to buy fuel, in a way they are being taxed. So there is that indirect tax, indirect taxation that is levied on NGOs. But there is also the other aspect of, if the NGO wants to import cars, they will not pay taxes. So that means that if you're running activities that are directly related to your mission as an cars for your organization, you're going to pay tax. To you directly related to your operations, you'll be taxed for them. I hope that is very clear. So there are conditions under which an organization can be taxed, and there are conditions under which the organization will not will be taxed. So taxes will be levied on them. Charitable sector is also another terminology that can be used to describe the non-profit sector. So you can describe the organization as a charitable organization. This can include NGOs, of course, and foundations and others. And then you have what you call civil society sector, or civil society organization. There is someone who is, please, the three of you, African Dr. James Madol, and then someone, please mute your audios. I can. Makur, you're saying that there is noise somewhere, but your mic is open. The noise could be coming from you. Okay. So there is this person who has not put the name. I don't know who you are. Your mic is open.
Josephine Achol.
Yes, you will need to close your mic such that You need to mute. All right. Yes. Okay, so we can go ahead. So those are the, and then the social enterprise, which I've already described. So those are the different terminologies that can be used to describe the non-profit sector or the non-profit organizations, or what we commonly use to call NGOs. Often when we talk about NGOs, it depends in different contexts. NGOs, of course, in our context of South Sudan, when we talk about NGOs, we think about this big organization. So in most cases, you think about international NGOs. But of course, we have local NGOs, which are quite very small. So in other countries, when we talk about NGOs, we talk about very few people, about 5 to 10, working about solving a particular problem in a society. So that is in other countries, but our notion of NGOs in South Sudan is it has to be a very big organization. But of course, we have smaller national organizations which have relatively very few people in the organization. So in the context of South Sudan and in relation to other countries, I think the non-profit sector is large.
Matut. Yes, hello.
All right, I had gone off for some time, but let's just continue. So we're discussing about how big the NGO sector is in South Sudan. And I was explaining issues related to, if we want to answer that question, where can we get the data? So if you want to answer that question, you will need to go to the National Ministry of Humanitarian Affairs. And what you're most likely going to find there are, of course, NGOs which have been registered and operational, and those that have been registered but are not operational. But you also need to go to the state, to the states, and see what organizations are registered at that level, local organizations, and also what organizations are available in those states, but they are not actually registered. And if you come up with, like, if you look at all that data, you can come to the conclusion of how much, how big the non-profit sector is in South Sudan. But it is also, you can also look at this in the aspect of how much money is spent. If you want to know how big the NGO sector is, you need to know how much money is within the NGO sector. So you can track this. Of course, this can be tracked through the financial systems, because every money that comes to the country should know. So money that comes to the NGOs, the government should be able to know. And therefore, we can now use the money as an indicator to know how big the NGO sector is in the country. So the commercial banks should be able to give us data about how much a particular NGO has. So for example, you can have an international NGO which has accounts with maybe EcoBank, Equity, with KCB, with Cooperative Bank. So you you go to these banks and get information about how much money belongs to NGOs, and then you can compare that with other countries and get to know how big the industry is. At the moment, I think, of course, we lack data on, for example, in the health sector, how many doctors are in South Sudan, and how many of those doctors are paid by the NGOs, and then how many of those doctors are paid by the government, and how many of those doctors are paid by the private sector. So if you know that, you're able to know the extent to which the NGO sector is supporting health, or if in terms of services that come into the country, of the drugs that come into the country. For example, if you're talking about drugs for treatment of malaria, how much of those drugs are procured by the government, how much of those drugs are procured by the NGOs, and how much of those drugs are procured by the private sector. So that can give you an indication of how, of the extent of involvement of NGOs in running health. So can you say that 50% of the healthcare services in South Sudan are provided by NGOs, or majority of the services majority of the healthcare services in South Sudan are provided by the government, or they are provided by the government with the support of NGOs? That is also another angle you can look at. So that's where we are. NGOs or charitable organizations can work in different sectors. Of course, at the moment, if you look at the landscape is that most organizations are focusing on the most pressing issues, which is humanitarian needs or basic needs. Basic needs include shelter, food, health, and then basically those alleviating stuff, and therefore the NGOs focus on health, on water, sanitation and hygiene, and then food, and then also education. So this, by proportion, you'll find out that most NGOs in this country are focused on those things. And this also brings a challenge that we face, that if we have organizations focusing on those things, it means that other important aspects of social development are going to be left out, and that is a huge challenge. So issues to do with political involvement, raising civic awareness, funding particular foundations that focus on particular diseases and things like that, may not be given particular priority. Okay, so in our context, we focus on health, education, making sure that people have shelter, they have access to water, sanitation, and things like that. So if you were to form an organization in South Sudan, which area could you want to focus on and why? I've just opened the floor for discussion. If you're going to open an organization, which area could you focus on and why? Yes, Lino.
Yes, good morning, Dr. Mawa. Because for me as health personnel,
Morning to you.
yeah, for me as health personnel, I'm still seeing a bigger gaps in the healthcare coverage. Up to now in South Sudan, we have not have a universal coverage of the healthcare services. So looking at the areas where we are operating now, many areas are still having those gaps. So I can still focus. I focus on health, making sure health services are reached. Yeah. Yes.
Okay. All right. So healthcare services. Another person? Who's going? Yes, Samuel.
Yes, in the content of South Sudan here, there are so many areas that need interventions that are not even reached by the government, and the services are not reaching. See, like now, the school are issues also, and then also the child health and ANC, particularly these children under 5, they are dying before the age of 6 years or even 5 years because of lack of services. And women are also dying during the deliveries because of unqualified personnel in the area. So all these areas, especially maternity, this is the most part that I focusing on a lot, so that we have so many trained midwives, a registered midwife, so that they have to, in each boomer, at least it should be having a ratio of 4 to 10 per boomer. So from there, I think it will help, because now the death, it is too much in South Sudan compared to other places where there is health service.
All right, thank you very much. Yeah, it is actually very, very hard for one to think of an area which is saturated, like for even the government to say there's no need to open an organization in this area, because I think we have met what we need. It's almost like in every sector there is something that is missing that needs to be done. Yes, Emmanuel.
Yeah, thank you so much, Dr. Mawa, and good morning, everyone. Yeah, as other brothers have put it forward, in South Sudan as a country, there are so many challenges. And
Yes.
These challenges are not only in one sector, different sectors. I look at education, is one of the biggest challenges. When we heard about the announcement on the SSBC on the number of students who have been actually doing well, who have done well, are only from private schools, which means the government schools are down. And we may talk of health, we may talk of malnutrition in South Sudan, we may talk of wash-related issues, we may talk of this. But if the illiteracy rate is 90%, how much the private sector or the organization will strive to correct these angles, still we may have a lot of impediments. And this impediment can only be eradicated through education. And I think one of the things, like there are some ALPs, adult learning programs that have been initiated by different organizations, but the funding that only goes to education sector, it doesn't go actually to the places that have been prioritized, but they end up somewhere there. So if I'm going to be one of those who will be having an organization or a CBO or CSO, actually I've been more focusing on education, because when we are educated, We must look at the hygiene. We must look at health promotion. We may be looking at nutrition, and all those things. When we have them, then we shall be able to actually eradicate half or maybe a third or a quarter of all those cases that are things related to malnutrition, things related to health related issues, things related to child mortality, things related to maternal mortality, so and morbidity. So all these things will be eradicated only if the citizens of this country got good kind of education. You look at different countries like Kenya, Uganda, you see the countries where the people are educated, the status of the people are different. And the type of the people and the type of work they do is far different. We have technologies, laboratories have been established, but if there are not people who have been trained and actually have that high knowledge on operating those machines, still we may have the same problems. Our country health system is deteriorating not because there are no personnel, but the people, the few who are working in those facilities, they are educated, but most of them, they are not highly educated. Meaning, when we are operating technology, technology can only be found when we are much educated and we got all the requires that need for a person to operate that machine. So I look at education is one of the driving factors to these all problems in our country here. Thank you so much.
Okay. All right. And as you were discussing those points, then I remembered one particular problem. I'm currently doing research on communal conflicts. And the stories that I hear and the things that I read about, and what the organizations are trying to do to make sure that there is peace building, there is dialogue, there is coexistence. It also leaves a gap. So as much as we focus on health, shelter, access to food, to fight malnutrition and what, we also have these man-made problems of communal fightings and things like that. Albino, what are you saying?
What am I saying? Good morning, everyone. If on my perspective, I would focus on water and sanitation. Water and sanitation have at least 4 indicators, and each indicator has also the components, program components. Why is it important to have this? Because most of the endemic disease in South Sudan, for example, diarrhea and typhoid, malaria, all are water related. However much we provide health facilities in South Sudan, and without water sanitation and hygiene, will be like doing nothing, or will be receiving many patients and we may not find a problem. One of the things is actually the promotion of hand washing, even here in Juba, leave alone outside rural areas. Someone cannot wash his or her hands with water and soap, but later when he or she eats fish, then that's when he will look for a soap. So I don't think after eating, then you need the soap and water. Or I mean, you need a soap, but you need a soap even when you have not eaten. With those 5 critical call time. The other thing is about fit latrine. Without fit latrine, we'll still have these many diseases, and even if we have more facilities, as I put it, we'll still have nothing
to have been achieved. So the other one is also it come alongside having access to clean water, because all attributed to contracting all those diseases. Thank you.
All right, thank you very much. One of the issues
Matut.
Yes, yes, Albino.
Morning. It shows your name appear twice. Are you using two devices?
Yeah. I'm using a computer and I'm using a smartphone.
Yeah. Okay. Oh, okay.
Yeah,
Thank you.
how are you there?
I'm doing good. I'm okay.
Yeah, my dear, how were the result for persons even? I think you got yours.
Yeah, I got it. Yes.
Okay.
Yeah, okay. Yeah, I just access on the
your email.
So not actually the email, but I got on the platform.
Platform, yeah.
Yeah, on the platform you can get them. How they ready this and that.
Okay.
Is it where exactly? I tried to look for it and I could not get it. That is a very interesting point now you have brought up. Yes.
Yeah.
I think that in the platform you need to go to your department, your public health, and then you go to public health section, and then from there you click exam.
Yes.
And then after clicking, and then it will show you all the model you have searched for, and then from there you go to grade.
Okay.
You go to grade.
You go to under public health.
Yeah.
No, Lino.
Yes. Yes, Albino.
The assignment. So when just there is model assessment, there is grading.
Yeah, correct.
So you click grading, then you scroll down. Yeah, you get detail for each models. Then you go to the other models. Yeah.
Yes, correct,
So
correct.
Yeah, that's
I got it because I am going even model grading, model assessment, and all this, and I don't find it.
Yeah, that is it. You scroll up to down. Yeah, scroll down.
Okay, thank you very much, Albino.
Yeah, thanks.
Simple.
Welcome.
Yes, Emmanuel. Emmanuel, welcome.
Yes, boss. Hello? Albino, you become the host?
Yes, I'm the host.
Thank you so much.
Oh, yes. He
Albino.
has pushed us. Yeah, he has pushed us to 9 a.m. now.
Up to 9 a.m. I think. Maybe we can wait up
Yeah.
to 9 a.m.
Yeah,
Yeah.
let me end the
The meeting, yeah.
let me end.
You end the meeting, yes.